Yeah. So what would be your approach when somebody comes in with low T?
Yeah. So the first thing, it's always, and I love doing this because most of the patients I get to, they would have gone to their primary care doctor first, right? And the symptoms of low T tend to be varied, but the ones that are more common, it's feeling tired, no energy. It's having decreased motivation, decreased drive. A lot of my guys will describe feeling blah. It's not a depression, although there's a lot of depression with low testosterone, but it's just feeling like you don't get pleasure in things anymore. Decreased sex drive, decreased erection strength, ED, all of those things are so crushing for men. Men don't even like to go to the doctor. So a man is experiencing those things. You know, he either went on in by himself, he read the forums, or his wife forced him to go. He goes to the doctor, they do a lab. Again, I'm not saying all of those symptoms are only testosterone. You know, as physicians, we're trained to have a differential diagnosis. So when a patient comes with those symptoms, right, they're tired, they have no interest in many things, they don't want to have sex anymore, they're gaining weight, you know, you're going to think, is this depression? Is this thyroid? What's going on in their life? Is this insulin resistance? What's going on? So we never used to have testosterone, low testosterone as part of our differential diagnosis, unless the man was in his 60s. This is where I think this needs to change. And this needs to change even with our colleagues in conventional medicine. Because most of the patients I'll get to, they told me they would have gone to their primary care doc. They're like, doc, I'm tired. I have no, I have no drive. Life is just blah for me. They do a basic level. They'll tell them you have low vitamin D, your cholesterol's a little down. If you insist, they will check just a total testosterone. They'll come back, your testosterone is 385, 420, normally it's 300 to 1200. They're like, that's good enough for you. So you stress, take a vacation, and on a lot of times, once everything is normal, here's an SSRI, right? I know as a psychiatrist, you've seen that a lot.
Psychiatrists definitely are not testing for testosterone. So all they're testing is thyroid stimulating hormones.
I'm going to tell you, a lot of psychiatrists in my area are referring to me now. I did a really nice presentation. There was a JAMA Psychiatry article in 2019 that showed the bidirectional influence of testosterone with depression symptoms. Patients with depressive symptoms tend to have a lower testosterone, and patients with low testosterone tend to have more depressive symptoms. And they showed that replacing testosterone, optimizing testosterone, increases the chance of resolution of symptoms by more than 50%. So psychiatrists are starting to be a little more open to it. And I'm getting a lot more referrals with this because we're going to the root cause. We're all into root cause medicine, how to go there. So that typical patient, right, they'll go to their primary, they'll get the basic test, they'll have a testosterone that's lower limit of normal, or sometimes it's low. Now the newest range for testosterone at LabCorp, the lower number is 264, upper number is 916. In the 1990s, it was 350 to 1950. Then it went 300 to 1200. Now 264 to 916. I had a guy the other day who came to me, 32 years old, with all the symptoms of low T with a level of 285. And they told him that was normal because he didn't go below that 264. And they offered him an SSRI. I was like, stay away from this. Stay away from this. And this guy, I talk about him a lot because it was a success story. 32-year-old guy who's a lawyer, has done great things in his life. And all of a sudden he felt like he had difficulty having kids, which is something we're going to talk about also, male infertility. Then finally they were able to have kids, but then he finds himself with all those symptoms. He had a level of about 380 when he came to me. And then we discussed, we went over everything. He was gaining weight. He wasn't interested in having sex that much anymore. Just didn't get as much pleasure. He was still doing well in his work, was able to maintain things, but it was low T. So after informed consent, his levels weren't completely low, but we explained, and we put him on our treatment. Testosterone being a great tool, but it's the whole entourage of nutrition, exercise, sleep, supplements, connection, all of this plus testosterone. Within 6 months, this guy was thriving. Within 3 weeks, he called us and let us know, my God, I want to do things again. The first thing you get when you replace testosterone in a hypogonadal man, it's that drive, that wanting to do things, that enjoyment of things that you get first. The physical energy, the physical changes come after, but it's amazing to see that. So this guy now, he changed his life. He was labeled non-compliant by his doctors, because his doctors just told him, exercise more, try to eat better and take a vacation. He had no energy. Testosterone was low. Now that we gave him what he needed, he was no longer non-compliant. He became like the self-motivated beast of a man. And we really, and something, you had a guest in your show, I forgot her name. She was all about sex education and how she was giving tips. Yes, she's amazing. She's amazing. I learned so much from her. But the one thing I'm coming from is we always think when there's any kind of sexual dissatisfaction or sexual dysfunction in a couple, it's mostly the woman who doesn't want it, it's the woman. Now it's happening to men a lot. If a man is having erectile issues, I like to call it, not even erectile dysfunction, right? That maybe the erection is not as strong as before, the desire is not there, maybe a premature ejaculation, you see you're not pleasing her, then you become disinterested. So both sides now are in a marriage that we can't please each other, like your guest said. And then, 15% of marriages are sexless, which is tragic. There's a sexual slump happening all over the world and even more in the US. There are so many 20-year-old men who are not sexually active, more than women. So yeah, a lot of this, is it social cultural changes play a role in this, but biology, low testosterone, hormonal imbalance has a really big role to play. I told you about that hikikomori phenomenon in Japan. The University of Kyushu finally did a study where they looked at those young men, and they saw in a lot of them low testosterone was at least the patients with diagnosis of hikikomori had a higher incidence of low testosterone compared to their peers. And it makes sense. You have low testosterone, you don't want to do much. And again, what are the causes? Could it be, too much porn-induced erectile dysfunction, porn-induced, it's the dopamine overload and you oversaturate your receptors, hormones don't work the same. There's a whole host of things that can cause it. But there's no question that we see our society is in trouble. We're looking at our younger generation. We're seeing a lack of drive, a lack of communication between the sexes, a lot of, because women have changed. Women have become now more independent. A lot of women, especially in their 30s, who are well-to-do, who've achieved a lot, it's hard for them to find a mate that can really handle them, right? The right way. So that patient, as we were talking, when you get that patient coming to, went to their primary care, and then now have the symptoms, I come up with my differential diagnosis. If I see that testosterone is not optimal, this is when we'll have the discussion into going into testosterone optimization. The guy still wants to maintain fertility. We have options like HCG or Clomid because testosterone does affect fertility. If the guy has gone through the fertility period, testosterone replacement makes guys feel amazing. There's no question. I'm on testosterone treatment. I started at 48, and that I'm 53 now. That's the best thing I did. It changed my life, completely changed my life, whether it's physical, mental, sexual, everything. It made everything so much better, even spiritual. And we're going to go into psychedelic medicine and all this also, how I see psychedelic medicine as the last optimization of the spiritual optimization to really bring mind, body, and spirit.